efforts to get South Africans vaccinated are picking up pace and striving for progressive heights, right? We've witnessed signs of relief and eyes fill up with hope since the start of the vaccine rollout in many parts of South Africa earlier in the month of July. But, and this is a huge but, the daily pace to get South Africans vaccinated is a constant work in progress. Well, it's interesting to know that there is a roving vaccine initiative to bring vaccines to 146 SASSA sites nationwide from the 3rd to the 6th of August 2021. The initiative is led by the National Department of Health together with all provincial departments within the Department of Social Development. Now, to tell us more, we are joined in studio by Research Manager at the South African Medical Research Council for Health Promotion and Communication, Jane Simmonds. Good morning, Jane. Welcome to the show.
Good morning. Thank you for having me.
We are running the story in our bulletins for obvious reasons. It's a big story. But let's first unpack the rollout of this vaccine. How is it going to happen?
So we've identified places where older people go.
Right.
Older people are not at work. They are not at school. They are not at church at the moment. They are not on transport. Where are they? They're at home. But every month, older people go to collect grant queues. 4.2 million people over 60 collect a grant every month. And this money is collected in different grant queue formats around South Africa, either at retail stores, at the South African Post Office,
yes,
at other service providers, banks, and also at the SASSA mobile cash payment points.
Right.
So identifying where older people are was the first step of getting them vaccinated. And then the next step was to take the vaccines to where the older people were. Because a big barrier to collecting or accessing a vaccine is getting there, the transport costs, the time needed. You're looking at people who are earning or collecting a 1,800 Rand a month grant. They do not have 100 Rand for transport or 50 Rand for transport to go and get a vaccine. So the reason for taking the vaccine to these people was to enable access to the vaccine and reduce the barriers to getting vaccines.
And also another deterrent would have been asking them to register online. As over 60s, it was a bit of a challenge for, I know it was a huge challenge for one of my uncles in Natal. Like, I don't know how to work this thing. Help me out.
Well, that was a huge challenge. And one of the things that we found is as simple as that older people can't actually read the font on their phones. So even if they have smartphones or even if they are familiar with texting and SMSing, they actually can't read the size of the font. So with older eyes. So that has been a problem. So by taking healthcare workers, volunteers, community workers to the grant queues with us at the retailers, we've been able to facilitate vaccination and registration in the grant queues, to do them both at the same time.
Let's talk about that, because I know a lot of them may not have necessarily registered. How are you going to work around that?
So registration now happens in the queue while people are waiting for their grants.
Okay.
So we've got people who are going in the queue, walking up the queues while people are waiting to collect their money, and they will do the registration on site. And once people have collected their grant money in the stores or at the bank or at the post office, they will then go to proceed to the vaccination queue, where they will wait, get vaccinated, be observed, and then be vaccinated, and well, have been vaccinated.
Two birds in one stone, Jane. That's incredible. Let's elaborate a bit further on why this is important, especially for the elderly, who I imagine a lot of them already have comorbidities.
Well, the elderly are the most vulnerable to COVID, and they're the most vulnerable to getting sick from COVID. You know, if you get COVID and you don't get sick, you can get over it. But if you are older, or if you have comorbidities and you get COVID, you can get very sick, and you can land up in hospital and you can land up dying.
Right.
And what we found is for every 400 people over 60 that we vaccinate, one life is saved.
Wow.
So that is a big improvement in the health outcomes of older people. So that's exactly why we're targeting at this age group. And 60 plus, especially people in grant queues, are certainly the most marginalised and vulnerable people in South Africa,
right,
and are often invisible and get left behind and are not seen. And these are the people that we need to look after, because if you think about the role that older people play in South Africa, 4.5 million children are being raised by grandmothers.
Yes.
Grandmothers are holding families together. They're holding communities together. Grandfathers also important in families with raising children. So we need to keep these old people healthy and safe to protect them and the communities and families in which they are living.
Let's talk about the real life challenges that you may have encountered during this process, Jane. Reaching out to the older people, making sure that they do come out while they're in the queue, they're registered, they get the vaccines. Have there been any challenges during this process?
So what has been interesting to see is that people are in the queues to collect their money.
First and foremost.
And if you say to them, do you want your money or do you want a vaccine? They're not interested in the vaccine. They've been waiting 30 days for this money. And I think what people don't understand is how desperate so many communities in South Africa are. And that by day 30, when it's grant payment day, families and households have nothing. So that has been the challenge, is how to make people feel safe enough to leave the queue to come and get the vaccine, and then to go back to the queue, or to come to the vaccine queue straight after getting their money. We've also found a challenge is that people are, by the time they get to the vaccine queue, they've been up since 2 or 3 in the morning. They've been queuing for 5 or 6 hours. They're hungry, they're thirsty, they're old, they're tired. So it's been important to keep that in mind. These are older people, and 60 isn't that old, but when you've, 70, 80 is starting to get old.
Let's wrap it up this morning, Jenny, and I wish we had more time. Who has SASSA partnered with for this rollout?
So it's been the most amazing public-private partnership. I mean, the partners that have come on board have been quite extraordinary, from the South African Medical Research Council, where I work, to the Departments of Social Development, Departments of Health, provincial, national, to pharmacy stores, to Solidarity Fund, to B4SA, to NGOs, Right to Care, to the post office, to Vodacom and MTN, who are pinging cell phone messages to people's cell phones from towers where grant queues are located, to finally to the cash and transit money truck companies who are delivering information on vaccines and then how to register to the vaccine rollout, queues at the SASSA payment points around the country. So really it has been an amazing initiative, and it just keeps growing. More and more people come on board as we get bigger, and we're hoping for a national rollout in September.
Pretty soon, hey?
Yeah.
Absolutely. Listen, I need to commend you. Incredible work that you're doing so far. Let's get it out there. Make sure that everyone in that queue going to get their SASSA money gets vaccinated, especially the older people. They are the most vulnerable, as you've said. That's Jane Simmonds joining us this morning, talking on the morning show.